Hi there, in this video, I'm going to show you some simple home remedies that you can use to chills. These remedies are all natural and easy to follow, so stick around and I'll show them to you right now. Chills can be caused by a variety of factors. Although cold temperatures are the most common, a temperature that causes shivering in one person may be completely comfortable in another. In addition to cold temperatures, the following factors may contribute to chills. Infection. If you have body aches and a fever along with chills, it could be due to a viral or bacterial infection. Colds, flus, and urinary tract infections are examples of common infections. Low blood sugar. Chills can be a sign of low blood sugar, which is dangerous for diabetics. Low blood sugar can cause mild symptoms such as chills and shaking, as well as more serious symptoms such as vision problems and seizures, according to the American Diabetes Association, ADA. Emotional reactions. Some people get chills when they feel strong emotions like joy or sorrow. These emotions can be triggered by real-life events or by music or art. Malaria. Although it is uncommon in the United States, people who travel to more tropical regions where this mosquito-borne infection is more common are more likely to contract it. If sweats, a fever, nausea, and body aches accompany their chills, trusted source should see a doctor. Inflammatory diseases, such as rheumatoid arthritis, can cause fevers that are sometimes accompanied by chills. Medications. Some medications can cause chills or fever. According to one study, 15% of people who had a bad reaction to medication experienced chills. Chills, fever, abdominal pain, and fatigue are all symptoms of blood cancers like leukemia. Have you ever felt cold chills run through your body, causing you to shiver even if you are dressed warmly or wrapped in a blanket? Body chills are one of the body's attempts to warm itself up, either because your internal body temperature has dropped significantly or because the body is attempting to fend off a threat. Cold chills can be a symptom of a minor, treatable condition like the common cold or a more serious infection like influenza or meningitis. Chills are experienced by some people who have inflammatory and autoimmune disorders. Body chills are frequently associated with fever, but chills without fever can also occur after exposure to extremely cold temperatures. Chills on their own do not always indicate a serious health problem and can often be treated at home without a trip to the doctor. When body chills are accompanied by other concerning symptoms, it is critical to consult your doctor because this could be a sign of a serious condition. What exactly are body chills? Chills happen when your muscles contract and relax repeatedly in an attempt to raise your temperature, which can feel like intense, uncontrollable shivering. Body chills can also cause you to sweat or feel unusually cold, which is why they are also known as cold chills. Chills can be uncomfortable, but they are usually not serious unless they are accompanied by other symptoms. What are the causes of body chills? The body will try to raise its own temperature for two reasons: if your internal temperature falls below normal, or if your body interprets a foreign threat, such as infection, that can be avoided by raising your body temperature. Your body wants to warm up quickly after being in a cold environment or immersed in water for an extended period of time, which is why you may experience chills. Chills may also occur if you are fighting an infection such as the common cold or the flu. Chills are one of your body's natural ways of raising its own temperature to combat infection, as most infectious pathogens cannot survive above a normal body temperature. Chills in the body can be a sign of influenza, flu, gastroenteritis caused by a virus, stomach flu, meningitis, pneumonia, strep throat. Fever and chills can also be symptoms of chronic illnesses like inflammatory conditions, autoimmune disorders, and certain cancers. Chills and their symptoms. Fever and chills are frequently associated when the body is attempting to raise its internal temperature in order to combat an infection or inflammation such as the flu, meningitis, or strep throat, among other conditions. Chills and body aches often go hand in hand, The rapid muscle contractions that cause chills can make you feel achy or sore, as if you had been exercising. When your body fights an infection, it often becomes extremely tired. Chills can also cause the following symptoms: coughing / diarrhea, lethargy due to nausea and/or vomiting, sweating / rash. How to get rid of body chills? If you have a fever and chills that do not go away after 48 hours, you should see your doctor for a physical examination. Your doctor may order diagnostic tests for a viral or bacterial infection based on your symptoms. Among these tests are urinalysis urine test, sputum culture from the lungs chest X-ray. Antibiotics may be prescribed by your doctor if you have an infection such as strep throat or pneumonia. If your cold chills are the result of a chronic illness, your treatment will generally follow the standard protocol for your condition. You can also try at-home remedies to get rid of the chills. If you have chills but no fever or other symptoms, or a very mild fever, generally 100.4 degrees Fahrenheit or less, you probably don't need to see a doctor and can treat the chills at home. Home remedies for colds. Getting plenty of rest and drinking fluids to stay hydrated are 2 at-home treatments for chills, especially if you have cold-like symptoms. A fever caused by an infection is not dangerous, but it can be uncomfortable. Wearing lightweight clothing or lying down with only a light sheet for cover may help relieve your symptoms. Take a cool shower or a sponge bath with lukewarm water for immediate relief from mild fever. Even if you're feeling overheated, don't let the water temperature drop too low because cold water can cause chills. You could also try an over-the-counter, OTC, medication to help with the chills and/or fever, such as aspirin. Do not give aspirin to children under 18 years old. Unless specifically instructed by your pediatrician, do not give aspirin to children under 18 years old. Unless specifically instructed by your pediatrician. Acetaminophen. If you also have cold or flu symptoms, OTC medications for congestion relief, sinus pain, cough, and running nose may help. Chills can appear as an early warning system, alerting a person that their body is fighting an infection, not getting enough glucose, or is simply too cold. They could also be a sign of an underlying illness. Anyone experiencing frequent and persistent chills should consult a doctor. Chills, even if they are a symptom of a fever or infection, will pass in most people within a few hours or days.